Welcome to the We Level Up Treatment Center video series. In today's video, we will discuss ADD versus ADHD symptoms. Attention Deficit Disorder. These ADHD, Attention Deficit Hyperactivity Disorder, are two terms that are often confused. ADHD symptoms include hyperactivity, impulsivity, and inattention. In contrast, ADD symptoms of inattention are related to an outdated term that refers to a subtype of ADHD with inattention symptoms. It's essential to get an accurate diagnosis from a healthcare professional to receive the appropriate treatment for ADHD. By examining these distinct types, we gain insights into how individuals' attention and cognitive functions may vary, contributing to a more nuanced comprehension of this neurodevelopmental condition. The term ADD is no longer used by healthcare professionals. Instead, the condition is now divided into three subtypes of ADHD. Each subtype represents a different pattern of symptoms and behavior. Predominantly inattentive type ADHD. The DSM-5, a manual for mental disorders, gives the rules for diagnosing different mental conditions, like ADHD. When it comes to this type of ADHD, which used to be called ADD, the signs of hyperactivity are not there. But people with it may still show these signs. Can't organize tasks or activities. You can be easily distracted from the job you are given. You often forget everyday activities. You always lose things that you need to complete work. You avoid, dislike, or postpone happenings that are not interesting to you. You always lose your concentration on projects, chores, or duties in the workplace or office. You can't follow clear directions. You seem not to be listening. You often make careless mistakes. You have trouble focusing on tasks or social activities. ADHD includes both the inattentive and hyperactive impulsive presentations, replacing the previously used term ADD. Predominantly hyperactive impulsive type ADHD. Individuals with hyperactive impulsive type ADHD will have the following signs. They will show signs of being constantly on the go, squirming in their seat, fidgeting with objects on their desk, or tapping their hands or feet. Regularly leaving their seat at inappropriate times, such as during work meetings, classes, or presentations. Talking excessively. Having trouble waiting their turn. Interrupting others in conversation or intruding on activities. Blurting out answers before a question is finished. ADHD combined type. The most common type of ADHD, is characterized by impulsive and hyperactive behaviors, inattention, and distractibility. Furthermore, the following conditions must be met. Several inattentive or hyperactive impulsive symptoms are present. Several symptoms are present in two or more settings, such as at home, school, or work, with friends or relatives, or in other activities. There is clear evidence that the symptoms interfere with or reduce the quality of social, school, or work functioning. The symptoms are not better explained by another mental disorder, such as mood, anxiety, dissociative, or personality disorders. The symptoms do not happen only during schizophrenia or another psychotic disorder. How is ADHD diagnosed? Scientists are studying causes and ADHD risk factors to find better ways to manage and reduce the chances of a person having ADHD. The reasons and risk factors for ADHD are unknown, but current research shows that genetics plays a significant role. Recent studies link genetic factors with ADHD. In addition to genetics, scientists are studying other possible causes and risk factors, including the following: brain injury, Exposure to environmental risks during pregnancy or young age. Alcohol and tobacco use during pregnancy. Premature delivery. Low birth weight. Research does not support the popularly held views that ADHD is caused by overeating sugar, watching too much television, parenting, or social and environmental factors such as poverty or family chaos. Of course, many things, including these, might worsen symptoms, especially in certain people, but the evidence is not strong enough to conclude that they are the leading causes of ADHD. Deciding if an individual has ADHD is a process with several steps. The symptoms of many other conditions, including anxiety, depression, sleep issues, and specific learning difficulties, might be similar to those of ADHD, which cannot be diagnosed with a single test. A medical checkup, which includes hearing and vision testing, is one stage in the procedure to rule out other conditions with symptoms similar to ADHD. A checklist for grading ADHD symptoms and obtaining background information from parents, teachers, and occasionally the patient themselves are typically used to diagnose ADHD. ADD versus ADHD treatment facilities need to support the family of those with ADD or ADHD disorders. Family-oriented therapies, such as couples therapy and family counseling, can help individuals and their loved ones develop healthy communication strategies that will lead to long-term recovery success. It is also essential for an ADD versus ADHD rehab center to provide education about mental health and its effects on both the individual and their family members. With this information, families can better understand what the individual is going through and how they can best support them during treatment and afterward. By offering comprehensive care tailored specifically for adults with ADD versus ADHD, mental health rehab centers can give individuals the best chance at achieving living fully again. The facility should have experienced staff knowledgeable about ADHD treatment and mental illness, so they can adequately address different signs and symptoms and comorbidities. Inpatient rehab provides a highly structured setting that helps individuals with ADHD establish routines and develop better time management skills. Intensive therapy. Inpatient programs offer intensive therapy and counseling sessions, allowing for focused attention on addressing ADHD symptoms and related challenges. Multidisciplinary approach. Inpatient rehab often involves a team of specialists, including psychiatrists, psychologists, occupational therapists, and social workers, providing a holistic approach to treatment. We Level Up Florida offers an ADHD treatment program at our mental health treatment center in Florida. Here, clients participate in clinical and experiential therapies as part of our comprehensive curriculum. If your loved one is struggling with their ADHD diagnosis, we can help them understand their disorder and teach them the skills they need to reach their full potential. Please call We Level Up immediately to learn how our detox and addiction treatment program will help you overcome your ADHD symptoms. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.